Hi, everyone. Welcome. Good evening. Thank you for joining us on this wonderful Tuesday night for us to talk about a really important topic that I know everyone is eager to kind of go through. And I just want to make sure everybody can see my screen. Ian, are we good here? We see the title slide.
Yep, looks good on my end.
Perfect. Well, thank you everybody for joining us. If you're not familiar or haven't been on one of our webinars before, my name is Jill Hasselman. I am the Chief Growth Officer for HR for Health. And if you're not familiar with HR for Health, we've built a cloud-based software really geared to helping dental offices manage their HR easier and more compliantly. And part of our job in this, in the last 11 years that I've been here, our job has always been throughout that time of listening to what our clients are having questions on or struggles on relating to the human resources world and helping to bring them resources around that topic. And so tonight's topic is definitely one of those. It's all about, how do I find people? And you probably have seen we're doing a lot of content around this. We have some really cool downloads for you guys tonight too of ways that we partnered up with Toothio, who I want to introduce Ian, the CEO and co-founder of Toothio. And Ian, thank you for joining us tonight and helping to share your expertise. And before we dove into content, I did want to make sure that you could give our audience a little bit of background on yourself and Toothio, and so they know where you're coming from.
Sounds great. Thanks, Jill. So for those of you that don't know me, my name's Ian. I'm the founder and CEO of Toothio. For those of you that haven't heard of Toothio, we are a platform that gives dental offices access to labor on demand through the platform that we built. So we've created a seamless process for you to connect with hygienists, assistants, and front office. There's some cool nuance to kind of how we do things, which we'll get into later. But essentially, we launched our company back in 2021 with the goal of helping alleviate some of these staffing challenges and shortages that we've all been facing. So excited to chat more about the industry as a whole and certainly these staffing challenges and how Toothio can help.
Yeah. And so this is what we're going to go through, kind of get a baseline of what the market is looking like right now. Ian has a lot of insight into that. And of course, whenever we're talking about bringing in new people into the practice, or even when we're talking about the existing team, we want to make sure that our audience understands some of the risks of not being compliant in those actions and just making sure that's buttoned up. And then, of course, want to be talking about once you're ready to bring that new person in, how do we make sure that you're prepared to do that and talk with these candidates and making sure you're classifying people correctly. That is a topic Ian and I discuss at length a lot of the times, and this is something we get a lot of questions on of how should I do this and what some strategies are around that. And then of course once you have that person, how do we make sure that they are ready to come into the office and that you are staffing them for long term, not just today if possible. So throughout, we do have Q&A at the end. Please feel free to type your questions into the chat, or the question box, and we will do our best to get to it before our time is up. Worst case, if we're not able to get to your specific question, we will follow up directly with you on the answer for that. So please feel free to put your questions in the chat for us. All right. So Ian, I'm going to kick it to you after this. So really, again, first we want to kind of set the stage for what the market is looking like and what our audience needs to be aware of. And I promised you that we would have some cool resources that are new. This is a brand new resource that we put together with the Toothio team, and really, making sure that you have all the A to Z's of dental hiring. So if you scan this QR code, it will allow you to download that guide. And we will also circulate that afterwards. But just want to make sure right up front we give you that resource. So, Ian, I'll kick it to you now of explaining kind of where we're at.
Awesome. Thanks, Jill. So at a just to back it up a couple steps. So my background has been in labor marketplace for my entire career, meaning over the course of my career, we've gotten really good at connecting person A to person B. And back in 2020, I ended up connecting with a doctor, a dentist on a golf course of all places. And he mentioned to me that there was a staffing crisis brewing. Certainly it got worse through the pandemic, as everybody knows. And then as I started to dig in a little bit more, I realized the problem was probably worse than I had even anticipated, even after having a lengthy conversation with this doctor that owned multiple practices out of Denver, Colorado. So a couple things we found, and this is what compelled us to get into the industry and find a way to help, is staffing is by far the biggest limiting factor in regards to growth or volume in a dental practice right now. And that's pretty unanimous. 90+% of doctors say that. 95% of doctors say they face difficulty hiring. 90% say they faced extreme difficulty hiring. Those numbers haven't fluctuated for about 3 years now, which is pretty incredible. We'll get into the reason why, but I want to kind of drill into some of these stats before we go deeper. 1 in 3 RDHs and DAs are retiring in the next 5 years. That number is slightly debated. You'll hear 20%, you'll hear 40%. We think it's somewhere closer to 30%. So the problem's not going to get any better. And then half of doctors report staffing as their top factor limiting volume. So that's the biggest limiting factor to them getting more production in their practices, seeing more patients, driving more revenue. And then half of dentists also say that they're doing RDH duties, which is a whole nother topic that we're not going to go too deep into in this conversation. But I think it's important for context just to know that you have a lot of dentists that are spending a lot of time doing hygiene duties when historically they have not done that. And so I think it just speaks to the staffing crisis that we're currently in. Vast majority of practices need more staff. And the dental industry as a whole is strong. It's growing, it's thriving, it's growing at about an 8% CAGR. It was growing at about a 9.5% CAGR 2 years ago. So there's a lot of good things happening. We just have to be adaptable and figure out how to not just survive but thrive in these times of limited staff potential.
Mhm.
Couple other just key points I want to highlight as we kind of set the stage for the problem here. Labor costs as a percentage of practice expenses is up about 30%. So we talk about, all this conversation about trying to reduce overhead and get more for less and, kind of increase our margins. It's really tough when your labor costs are up 30%, which everybody is facing. About a third of RDHs and DAs are showing signs of burnout. I'll talk about this a little bit later, but about half of the reasons for dental professionals quitting and leaving or attrition is due to some burnout related symptom. And then, like I mentioned, 1 in 3 RDHs and DAs are retiring in the next 5 years. There's a massive staffing shortage. We're about 11% understaffed as a market, and most doctors are reporting that it's extremely difficult to find staff. Put a little chart in here to talk about just kind of the retirement of DHs and DAs. This is self-reported, so pretty good data. But once again, about a third of dental hygienists and dental assistants are retiring over the next 3 to 5 years. So very difficult environment, and no path, at least in the short term, to getting a lot better, unfortunately.
Mhm.
And then I mentioned this a little bit, but overall demand for dental professionals is growing. And that would make sense considering the industry is growing at about a 9% CAGR. I think it was 8% last year, but it's bouncing back to 9% this year. So it's growing steadily. As we have this demand growth in the market, naturally there's going to be supply increase and supply growth that needs to happen to keep up. Unfortunately, we don't have a lot top of funnel that's coming in, so new supply that's coming in to fulfill demand. So we're gonna have to get more creative with what we do with our current supply and really speaking to them and giving them solutions that empower them to engage in the workforce the way they want. And we can get more out of and help drive our practices and increase patient retention and patient results as well. The top of funnel is shrinking. So we've seen a dramatic decrease in enrollment in dental hygiene schools, and we've actually seen a decrease in the total number of assisting schools, not just enrollment, but in the total number of assisting schools that are out there, which is probably an indicator that there's not enough new assistants that are coming in to justify keeping those schools operational. So I think this is a systemic problem which we're not going to solve in this webinar, but I think it's important just to understand that this is a problem. It's going to be a problem for a while, but there are ways that we can help alleviate the challenges and get more out of the labor force that exists currently. Some quick stats. This 16,300 RDH job openings fluctuates about 2,000 on either side and has for the last 3 years. It's not moving, so there's always a tremendous amount of RDH job openings posted. Like I mentioned, 1 in 3 RDHs and DAs are retiring in the next 3 years. Very difficult to find staff. We have half of dentists that are, doing hygiene. one thing I think is super interesting is almost 7 out of 10 dental professionals are saying they want flexibility in their schedule, which we'll drill in a little bit more here in a bit, but I think it's important just to understand that it, if we want to get more out of the dental labor force that we have access to, we've got to be able to speak their language, and we've got to be able to give them the tools that they want to empower them to continue to engage in the workforce. And so we'll talk a little bit more about how Toothio does that later. Um, a couple other key stats here. Most practitioners are concerned about staffing. Patient flow is hovering at about 84%. Most people think patient flow is down because of the staffing limitations that they have. And then most, 40% of practices are chronically understaffed. So not just a little bit understaffed, but chronically understaffed, which is driving the burnout to their existing employees, their existing hygienists, their existing assistants. They're taking on more of the load, which leads to higher attrition, which snowballs from there. So once again, we've got to figure out how to do more with less.
Mm-hmm.
So what can we do? I think, that seemed like a grim outlook, but I promise you it's not all grim. There are some encouraging signs. But what can we do? So one of the things we can do is we can utilize flexible labor. And there's a lot of reasons to do this. There's solutions everything from opening up additional appointment blocks to when some people call out or get sick, plugging a hygienist in. We'll talk about what I call like the 70-30 rule in a bit, but how staffed do we want to be able to handle fluctuations in patient demand, seasonality, and also emergency appointments that pop up. And then the other thing we can do is we can maximize how we retain our existing staff, which I want to be, certainly part of the focus today is how do we make sure that our existing staff is happy, stays where they're at, and we get the most out of them as well. Versus, most practices are seeing fairly high attrition, record attrition, unfortunately, right now. So we've got to figure out how to retain our existing staff and then use contingent labor solutions to augment our staff. And part of that is comes back to onboarding more effectively.
Mm-hmm.
So I'm sure most people are probably familiar at this point with contingent labor. There's a handful of platforms out there. I think, temping, as it's been called, has been part of the dental industry for a very long time. But it's more prevalent now than ever. There's statistics that show somewhere between 30 and 40% of the dental labor force is now transient. So they're working in some sort of temporary capacity. That could be a shift a week, a couple shifts a month, but they are working in some sort of transient or gig-based capacity. Um, Really, some of the benefits to leveraging a contingent labor force or a temporary labor force is avoiding the loss of production. So when you cancel a patient, there's debate on how much that actually costs a dental practice, but somewhere on average, we're talking about $1,200 to $1,400 a day. When you factor in the attrition, the patient attrition, when you have to reschedule them 3 to 5 months out, that number compounds and gets north of $10,000, closer to $20,000 in a lot of cases. So it's very costly to reschedule your day. You're going to lose patients, and obviously you're going to lose the production of that day. So we want to make sure we do everything we can to avoid that, which is where temporary staffing or gig-based staffing can really come in to help augment that. You can certainly increase your production dynamically. So we've seen a ton of offices over the last few years that have utilized our platform to actually open up more appointment blocks, see more patients, avoid having to reschedule 3, 4, 5 months out. The way we think of production when you reschedule a patient out is not that revenue was pushed out, but that revenue was lost, right? Even if you do see them in 3 to 5 months, that revenue would have been that revenue was lost because it would have been filled by another patient that you wouldn't have been able to see. So it's not just pushed out revenue; it's truly lost revenue. And then I think one of the most overlooked ones is supporting our existing staff to avoid burnout. 50% of reasons for attrition, meaning your internal staff attrition, is due in some way to burnout. And we understand why, right? There's less dental professionals out there. They're having to do more, and when that happens, burnout is inevitable. And so I think one of the things we're seeing some of the most successful practices do is recognize that one way they can retain more of their internal staff is by augmenting their team with temporary contingent labor that can come in and take that load, take that burden off of their full-time staff. So really important tool, and I don't think a lot of people think about it in that way. It's not necessarily because you had somebody call out that morning, or because you're a little short staffed and you can flex somebody into that opportunity or that role for the day. We've got to think about the long-term happiness of our internal teams and how that feeds into attrition, which is also very costly. And then the last thing is reducing overhead. So this is, I think, one of the other kind of most underlooked, or I guess overlooked, things that you can make up for with contingent labor. Um, you can, traditional W-2 overhead, when you factor in payroll taxes and insurance and sick time and everything else that comes around with that, is 20 to 30%. So whatever you're paying that hygienist or that assistant, take another 20 to 30% on top of that is really what your fully loaded cost is. And one of the things that, if you find a great, dynamic, flexible contingent labor solution, you can actually reduce your total overhead and actually gain efficiencies in the practice and increase your margin in that practice, by not having a fully staffed, fully ramped internal team year round and flexing in this contingent labor, when you see seasonality, when you see emergencies, when you have to reschedule patients, and then generally when you just want to see more patients. So I think these kind of 4 or 5 factors here are, when used appropriately, are hugely beneficial to these dental practices. You can gain significant efficiencies within your practice, that add up and compound over time. And then just to touch on this is something that I keep kind of harping on when people call me and say, "Hey, we're losing staff. We don't know what's going on." For me, it always comes back to onboarding. 90% of the time, it's something to do with the expectation setting, the onboarding experience early. Did they get the training they needed? Did they get the attention they needed? Um, you know, that those first 30 to 60 days are instrumental. They're crucial. And Jill and HR Pell knows so much more about this, but they're crucial for retention, with your internal team as well. So
Yeah.
the employees that have a good onboarding experience are significantly more likely to stick around for a long time.
Yeah. Yeah, and as we kind of look at we see the problem. I think Ian, you did such a good job of illustrating really what our clients are up against, and we want to talk through, okay, how do you navigate this while also doing things correctly? Because the last thing that we want is for all of these things to be happening, for you not to have team members to see the patients that want to see you, and then something happens because you've been out of compliance. And so what you can see is, so according to the US Department of Labor in 2023, they recovered 24 million in back wages, for roughly 20,000 workers in that year. And a lot of it is related to misclassifications. So what we want to look at, and Ian touched on this, is that when you're hiring somebody, this is the opportunity to set yourself up for success from a compliance perspective. And while we don't want to focus on termination in this webinar, if you haven't set things up correctly from the beginning and down the road you do need to part ways with an employee, it can be much more difficult for you to do so, and for our team or other HR teams to be able to help you to do that in a clean way if the expectations and protocols weren't followed from the beginning, because then it just compounds. So what we are looking at is that this can misclassification or not correctly onboarding an employee can result in fines and penalties for things like back wages owed and taxes, violating labor laws. So if somebody should have been classified as an employee and wasn't, or if you just are violating labor laws, so like the Fair Labor Standards Act, Equal Employment Opportunity Laws, American Disabilities Act, the ADA, this can also result in fines and legal actions. And also, maybe something as simple or maybe not simple that you might overlook is that not having an employee properly complete their I-9 can also lead to noncompliance with immigration laws, can lead to penalties because you're not authorizing that that person is able to work in the United States. So these seemingly small things can, add up to larger things. And then it can also lead to audits, investigations. So these federal and state agencies that we're talking about actively monitor compliance. And again, something seemingly small can come up that raises their alarms to, well, what else is not happening? So investigations for things like the Department of Labor, Equal Employment Opportunity Commission, or even OSHA, like not classifying or not correctly onboarding, can lead to this. And I think it also can't be overlooked that any sort of lawsuits or legal violations can really break down trust with both the team, your current team, and with patients, and can impact your practice's credibility. Social media, public reviews, these things can be amplified when there is a negative hiring experience that can impact the practice's brand. And it also can impact, the employee morale and increase turnover rates, which is exactly what we're trying to avoid. Because at the end of the day, we want the employees to feel safe and valued, and that we are committed to making sure that their work environment is what it's supposed to be. Ian, I do want to give you kind of pass it back over to you to talk about some of these other gaps that can happen with like the flexible workplace piece of this.
Yeah, so I think it's the flexible workforce piece is like a very interesting component because I think for a long time there hasn't been a lot of education in this space, and
Mhm.
so you get a lot of like conflicting opinions and views, and then also like out
Yep.
of desperation we do a lot of things that maybe aren't compliant. It's nobody's judging or blaming a practice for doing things that aren't compliant because they're under so many different constraints and so many
Right.
pressures. But I do think it's important to just generally know like what some of the best employment attorneys in the country and also the government says about this. And one of the things that it says pretty clearly is that you as a dental office, if you're bringing in temporary or contingent labor, you should not be paying those workers, those professionals directly yourself. You should not be collecting their information, issuing a W-9, paying them, and classifying them as an independent contractor, mostly because you already have W-2s that are fulfilling the same position in that practice, and that's where the gray area starts to happen. So, and we'll talk about this a little bit later, but I think it's really important if you are using solutions for contingent flexible labor, gig labor, whatever you want to call it, when you're bringing in these temporary people, you should not be paying them. You should be whoever you contract with, whoever's actually, making the connection between the professional and your office should be the ones that handle payment, which not a lot do, surprisingly. There's a handful that do, but not as many as you might think. So you might think, well, I'm just going to reach out on Facebook groups or I'm going to pick up the phone and call, Susie, my neighbor. But unfortunately, if you do get flagged, there are fines associated with that because it will be misclassification in that case. The other
Mhm.
thing that we see is documentation gaps. So when you bring a hygienist into the practice, we need to make sure that they have a license that's active, that's not expired. And the reality is, it's oftentimes very difficult to check, especially when you're busy running around and you're bringing somebody else in from the outside. So whoever you end up contracting with, we want to make sure that we have their active license and then any other certifications associated with that professional in the practice, whether they're an assistant or a hygienist. Make sure they have the proper certifications to be doing the job they're supposed to be doing in the practice. And the last component is insurance coverage. So if you bring somebody in, out of a Facebook group or through your network, they're not going to be covered by insurance unless they have their own, which is extremely, extremely rare, right? Less than 2% are going to have their own insurance policies. It just doesn't happen. So what we want to make sure of is that they have insurance coverage through whoever you're contracting with to bring them in. So like in our case for Toothio, we make sure that every dental professional is covered with a general liability, an occupational accident insurance, a professional liability, and a couple other policies that are not necessarily uh, likely relevant, but relevant if things go really south. So you want to make sure that you're covered because accidents do happen. You're dealing with sharp tools and you're in people's mouths, and unfortunately things do happen, whether it's with the patient or with the contractor that you brought in, the temp that you brought in, or equipment that's in the dental office. You want to make sure that all three of those are covered. And so we see it happen too often when one of these things is missing, and it definitely tends to blow back on the practice in a pretty negative way. It can be very costly.
Yep. Yeah, so keeping all of these things in mind, and as Ian mentioned, we're going to dive into the classification piece a little bit more in a bit. But now that we've established, okay, we need to find people to bring into the office. Whether that is again through temporary or direct placement. The first thing that I think is important to keep in mind is that as you're preparing for this interview process to find people to bring them in, keeping in mind that based on those stats that Ian was showing, is that candidates likely have more options for jobs than you have for candidates. So there are more roles that are open for them than the people that you have applying to your individual role. And so as you're going into these conversations, you want to make sure that you're also selling them on working with you just as much as you're interviewing them to make sure that they work with your team. And I think in this piece, it's really important to be realistic as well so that you're not setting up that candidate for, failure, or you're not being honest about the situation at hand. But if you really are this practice that has a lot of these perks and that are really looking for good fits to come into the practice, that you're openly talking about that and what that looks like. And so the first step is really thinking through what your interview process is going to be, meaning, is it a phone screening and then it's in person and then it's a working interview? Whatever that looks like, make sure you're communicating this right from the beginning as you're connecting with the people that are looking to come into the office to see if the role is right for them. I think also it's important to communicate when you're looking to make a decision. The time is of the essence if they are looking at other roles and other practices. And so make sure you're explaining like what the timeline is and when you want this to be done, and hopefully have them in your practice. This QR code is also another resource. This is something that our clients and dentists around the country really like, which is this download of 75 best interview questions to ask potential employees. And I want to kind of walk through some of the do's and don'ts, because this is where the gray area can start to come in, because we are really eager to get a warm body into the office and start to see patients, but we might overlook some of the best practices to do this. So an example of a good question that can be asked, and you want it to all be as objective as possible and connected to their role as possible, but tell me about the last time you had a conflict with somebody that you worked with. How did you handle it? The reason that I'm posing that as an example question is we've seen an uptick from our HR team at HR for Health of clients calling in about interpersonal issues with their team. I think that that's related to the burnout, it's related to the stress, it's related to a lot of different personalities coming in quickly. And so this is a good question to ask if that's something that you're dealing with, and and listen to how they answer the question and what information they share with you about that situation. So you really want to ask job specific, skill based questions to evaluate their qualifications. And absolutely make sure that every candidate is asked the same questions to make sure that it's fair across the board of everybody that you're interviewing. So you're wanting to look at evaluating this culture fit, the team dynamics, the work environment. These are all things because you want this person to be a long-term fit for the practice. Absolutely using a job description as a starting point is essential, so that you're using that as your reference as your true north for what you need in this candidate, and as you're coming up with the questions and kind of the process. And then make sure that you're writing down all the questions that you're asking. Ideally, I like to have like a template that has my questions in there, and then I'm making my notes. Make sure, again, everyone's asked the same question, and then you're writing your notes in an objective way based on the way that they're answering and the information that you're collecting. And then really important, especially if you're having other team members involved, which I recommend, I actually think it's a good idea to get different perspectives, but make sure that those team members or team member, whoever it is that is involved in the interview, is also aware of the consistencies that's needed, being objective when interacting with these candidates, because they probably don't have, I wouldn't expect them to, formal training from an HR perspective of how to communicate with candidates. So make sure you're talking through that with them. Again, ideally, you're giving them a set of questions or asking each person and guiding them on the best way to kind of notate that. And the best advice is always staying objective. What you do not want to ask is anything about age, marital status, any protected characteristics. So a good example of this is you do not want to ask somebody if they are a citizen of the United States. What you can ask them is, are you authorized to work in the United States? So those are two different ways to ask that question of essentially the information that you're trying to find. You definitely do not want to have any questions about their, religion, or again, like age, nothing that's going to get you in trouble that is information you don't want to know. And really that's not relevant to their individual role. That's what you want to keep your questions very specific, not subjective, not vague, but connected to their role. And then make sure, if you are in a state where a lot of states now do have salary inquiry history bans, meaning you can't ask an employee what they used to make at another role. You can ask them what they expect to make in this current role. But the reason why these laws have been passed is that it's trying to make the wage gap smaller. So if we're constantly referring back to what they used to make and paying them that, it's not helping to reduce that wage gap. So that's the reason these laws are in place. So just keep that in mind. If you're not sure if you're in a state that you're not allowed to ask about salary, you can reach out to us, or just when in doubt, you can ask them what they expect to make, but just don't ask them what they used to make. And again, this resource has a lot of other questions that help you of what you can go into. Another piece is, again, these job descriptions. I cannot overstate it. I think it's absolutely an overlooked thing, especially when we're really eager to get somebody into the office. But you want to make sure you have these job descriptions. If you're a client of HR for Health, you already get all of our job descriptions in our system that you can tweak if you would like to the specific position. But it's a really important starting point to make sure that the people that are applying to these jobs know what they're applying to, and that they understand what the role is. And then you're also going to use that job description as a starting point for a good onboarding process from day one. Also, things like interview guides and step-by-step tools to ensure that you're doing everything fairly and compliantly. I'm going to get on my soapbox for a second. Please use employment applications. I think this is something that's also overlooked. If you're a client of HR for Health, reach out to us. We can get you these employment applications. This not only helps you to gather the information from the candidate all in one place, but it also helps if you plan on doing things like reference checks or background checks. This is a place where you can receive authorization to do so if you're doing those things. And again, it keeps it all in one place and makes it really easy for you to go back and reference what that information was for that person. And if you are going to use employment applications, let's say you already have one, you're going to, dust them off and start using them again, just make sure they are state specific and they're updated with the most recent laws. So that salary history that I mentioned, ban the box laws, meaning, we can't have check boxes in a lot of states on our applications about any like criminal activity or things like that. So again, it's nuanced per state, but just make sure if you're using one, which I highly recommend, that it's up to date. And if you have questions on that, you can reach out to us. Again, as a client, that's something that will give you no problem. And then documentation is your best friend. So easily documenting these things. It's why I like employment applications. It's why I think, you should have your interview questions templated, easily tracking these notes of why you are hiring somebody or why you're not hiring somebody, to make sure there's that transparency and compliance. So let's jump into the classification. So the difference between the employee and independent contractor. As Ian mentioned, there are absolutely strategies of using temporary staffing agencies or whatever you want to call it to help to fill in these gaps. And typically they are independent contractors. So that's what we see very commonly. And while that's okay, it's important to understand the difference of if you're doing this yourself directly with a new applicant versus if you're working with a company to help you do that. Because there are complex regulations around hiring and paying an independent contractor correctly. And this is where these really small, seemingly small errors can create really big, expensive problems. So the general rule for somebody to be an independent contractor, and again, this does vary per state, but generally speaking, it's pretty similar across, which is the independent contractor has the right to control or direct the result of their work themselves. So the independent contractor is in control of their work, not how it will be done or what will be done. So, in other words, they're typically making their own rules. They decide whether they're going to work, when they're going to work, how they will work, and you're hiring them kind of on a project basis. So, this can be a hard standard to meet if we're talking about certain positions in the practice. If you think about an assistant, you can't really let them make their own schedule if you're bringing them in directly and paying them. So, again, Ian made that really important distinction earlier that most likely if you are not paying this person, if you're not giving them a W-9, if you're working through a company like Toothio, it's usually okay. But this is also why we're working with Toothio, to like help with those checks and balances and make sure everything's okay. Because what you want to think about is if you're bringing somebody in and you get them direct from Facebook and you're like, well, this person's only going to work in my office for 3 days, I'm just going to classify them as an independent contractor. You actually need to think about it's not actually the time necessarily that they're spending in your office, it's what they're going to do and how much control you're going to have over their work and how much independent decisions they have on how they're working with their patient, how they're working with your patients, and if they're able to set their own schedule. So again, they may qualify as independent contractors, but there is typically a lot of risk classifying them that way. And the reason is because these consequences have a ripple effect. So if somebody is classified as an independent contractor, they don't receive the same rights as an employee. And so if they should have been classified as an employee, but they're classified as an independent contractor, then that person is missing out on rights that they have for certain offerings. So things like minimum wage or overtime, also benefits. We talked about the insurance piece, paid time off. If you're in a state that requires you to offer sick leave to your employees, but you're classifying them as independent contractors, then they aren't given any time off and they should have been, by law offered this sick leave. And it's also important to remember there are two government agencies that care about properly classifying your team members. So there's the IRS and then there's the Department of Labor. So IRS cares because they want to make sure taxes are being paid correctly. And if you're classifying somebody as an independent contractor and you shouldn't be, then the business and the team member aren't reporting wages in the same way as if that person was an employee. And then the Department of Labor cares because it's their job to make sure that workers' rights are being upheld. So again, it might seem like it's not a big deal. This is something that's just never really gone away in all the years that I've been with HR for Health. This continues to be a question. And I think that it's really important to just educate yourself and on, a case by case basis. If you're not sure, like reaching out to get help and working with companies like Toothio and HR for Health to make sure that it's okay. Because, it can really deprive employees of essential protections if they shouldn't have been classified as an independent contractor directly through you. So really important to keep in mind. Again, one kind of dire situation that happened is when COVID happened and everyone had to lay off their teams and or furlough them. A lot of the team members that were classified incorrectly as independent contractors, they weren't paying into unemployment because independent contractors don't. And so they weren't able to file for unemployment initially. And so again, I'm not saying that this drastic of a situation would happen again, but it's really important to review for like your current and future roles. And again, to Ian's point, if you have existing team members that are classified as employees, as that, they get a W-2, then it's really hard to justify like, well, this person's a contractor just because they're going to be here for 3 days or 2 days. That doesn't necessarily mean that it's kosher. So if you have any questions on this or are confused, like please reach out to our teams. We will help to clarify again for each individual situation. If there's a specific state that you're in that you have questions about, some are very strict, some are maybe a little bit more lax. We are here to help because we know it's confusing. So Ian, before I have you chime in on this, I'll say just kind of from the HR for Health side of things, we want to make sure that your employees are classified correctly. We want to make sure that it's really easy for you to be able to onboard your team. And that's really our goal. So our software is going to help to automate a lot of these pieces. One example when we're looking at onboarding and new hire documents is there's on average 10 to 12 new hire documents that an employee must receive on their first day. An employee, so if they're a W-2. This number varies per state, but we typically see when we start working with offices, they have about 3 to 4 documents. So they're really far away from that total number of what's needed. And so when they're put into our system, we are going to automatically send out every new hire document that you're required to provide to your employee. The employee goes through it, signs all these documents digitally on their first day. The documents are stored in the cloud to be accessed from whatever, and then we maintain these documents as updates change. And then same thing as somebody's classified as an independent contractor in our system, the relevant documents go out, they're completed, they're stored, all of that. The software also takes into account your employees' hours, their status, their job description. It makes sure it's tracking hours for overtime pay. And then our team also is here to kind of support you through that journey. So we're helping to provide guidelines and guidance to make sure that you're handling your hiring process correctly. For example, we aren't even diving into this tonight, but how to do working interviews correctly. Our team is here to help provide resources, and then also just a phone call away. If anything goes awry and you need additional support, we're here to help. And Ian, I kind of want to let you chime in too on some of the resources on Toothio's side to help with a lot of the, complexities that we've been talking about.
Yeah, I think, on our end, what some things that we do to make sure that that we're compliant, our dental professionals are compliant, and our dental practices are compliant is we collect everything up front before they ever have a chance to even accept a shift on the platform. So every single license, everything, every single certification, work history, we get all their information. And we are the ones that handle any of the classification issues on our end because they're contracted through us and we're handling the payments to those professionals. So what we're doing is we're assuming, all the liability for classification. Whereas if you go outside the system, you go to a Facebook group, you go to a friend down the street, oftentimes some of those boxes aren't going to be checked. And if the Department of Labor comes knocking on your door, there's probably going to be fines and definitely some headaches that come along with that. So on
Mhm.
our end, we make sure that there's never a professional sent to a practice that's not certified appropriately, with those certifications tracked and in the system, making sure that they're able to work, making sure that they're able to be paid, making sure that all the information is set up correctly. That way, you don't have to worry about that. Jill mentioned the 12 different hiring docs. Well, there's a similar number that goes into what we do on the independent contracting side, as well as the system of checks and balances that we have to make sure are followed to stay compliant. That
Mhm.
unfortunately is just really difficult to track if you're doing it directly.
Yep, agreed. So, yeah, I mean, consider the compound interest of a great hire. That's something that's so important. Like, we're taking the time to hire somebody that is great and we're providing, this onboarding, but we want to make sure that it's a really good experience because then they are more likely to stay. They'll be happy to share with other people how much they enjoy working for you. So, it's really important again when you're looking at you're ready to onboard this person that you only get one chance to make a good first impression. I always like to compare this of it's just like when you have a new patient experience, you're really guiding that new patient through what to expect. You're showing them the culture of your office. You're really making a great first impression. We want to do the exact same for our new hires. So, again, making sure you're giving all necessary documentation to your team. So remember those 10 to 12 new hire documents. Again, if they're coming to you direct, alerting your payroll company of the new hire to make sure they're properly reporting that new hire. If you're using HR for Health Payroll, we're doing this on your behalf already. Toothio's handling that if you're going through their system. And then if you have not updated your employee handbook for 2025 yet, now is the time to do it. The employee handbook is our bread and butter. That is our true north and kind of how we're going to handle employee situations. It's going to establish clear expectations. It should define your practice policies, procedures, your culture, and then it needs to set expectations on conduct, attendance, performance, all of these things. If you have not looked at your handbook, in the last year, again, now's the time to do it, but really looking at what's my cell phone policy? What does it say in writing? Am I actually holding my employees to that? Does my attendance policy say somebody's not allowed to be late, but am I actually tracking that they're late? Am I using HR for Health's time clock to make sure I'm monitoring if they're clocking in late or if they're clocking in early or if they're not showing up at all? Really important to kind of just do this like cleaning of house, if you will, of what was serving you and maybe what's no longer serving you in your policies. And it's also ensuring that legal compliance. It's making sure that you're protected with all the new laws that have come out. We're in California. I'm personally in California. We always are having new laws come out. We're already gearing up for new laws that we know are going to happen in July. So it's really important to have these covered because these laws say that you do have to have these policies in writing to provide to your team. And then also standardizing guidelines across the team and creating that consistency, preventing that miscommunication is so important. Like, you shouldn't just have your employee handbook, you need to actually use it. You need to refer back to your policies that state how you're going to handle certain situations and handle them in that way so that you're avoiding not just legal risk, but you're avoiding contention that can build and that lack of trust from your team if you're not following through in terms of what you have in writing. This also really improves the onboarding experience because it's giving these new hires a clear guide to follow. and reducing confusion. So it's not, again, it's not just enough to have your employee handbook done. You need to be using it. You need to make sure it's in front of your employees, and that they're aware of what really sets the tone for a positive work relationship. So cannot stress that enough. It's so important. There's no time like the present to get that updated. And if you have questions on that, of course, reach out to us. And last but not least, providing those correct expectations to the new hire. So don't overlook things like telling them when they should arrive, like who's going to be greeting them when they get to the office, where should they park, what should they wear. All these things are really important for that first day, that first week, to set the expectations correctly. Because then we're going to look at ongoing management. How do we really keep these employees for the long term? So again, if you've not updated your employee handbook or your policies in the new year, now is the time to do it. If you're a client, we automatically update your employee handbook as laws change. So if you're a client on this webinar and you're wondering about this, we already pushed out those updates for the new year. But you can always reach out to us if you want some customization in terms of specific policies. I also, when you're onboarding employees and kind of ongoing maintenance, focus on what the employees care about. So, one thing they really care about is paid time off. So, take time to explain what your policies are. Absolutely explaining what happens if multiple people request time off at the same time. What's your practice standard for handling that? And making sure it's written in your policy and then you're following through. Also, how far in advance should somebody request time off? These are all connecting back to what Ian's talking about in terms of burnout. Like, it's not just enough to give them the handbook and say, this is what your time off is. You really want to take the time to make sure they understand it and encourage them to take time off, and giving them that reassurance that when they have that time off, you're going to make sure that there's coverage and do everything you can to possibly do that. And then you also need to make sure you have a system that tracks exactly what is written in your employee handbook in terms of time off in a system that's visible to the employee. So the biggest discrepancy we see when we start working with a client is that they have one thing in writing of what their time off is, and then they're doing something completely different in terms of what's actually being offered and what's actually being tracked. This is a very quick way to lose trust with your team. Again, thinking about what they care about, they want to know what their time off is. And so if they can't see that in real time, if they don't know that what's in writing is exactly what they're going to see in a system and they can request off through the system and they have that power kind of over their schedule, again, you're putting the guidelines in of what happens if multiple people request time off, how far in advance they need to request time off. That's going to help you with the coverage, but they need to be able to see that what you're saying and writing you're giving them is what they actually get, because that's the quickest way you can lose trust with your team, is if that piece is chaotic. And so again, if you're not using this piece of our system, if you're a client, we take exactly what's in writing in your employee handbook and we set it up for tracking in the system for now and for future. So reach out to us if you're not utilizing that feature, or if you're not a client, you have more interest in that, please do that so that we can walk you through it, because it's really, really important that those things are aligned in terms of what you're telling your employees you're going to do. Also, I highly recommend, Ian mentioned this, but really recommend doing 30, 60, 90-day reviews, and then at least annually from there. Again, this is an expectation to the new hires, and then make sure you're following through. So you're telling them we're going to have a 30-day, 60-day, 90-day check-in. Here's when we're going to do it. This is what we're going to review, and then actually do that. So the HR for Health system, again, if you're a client, it's going to automatically alert you when it's time to do that performance review, that 30-day, 60-day, 90-day. And then you're completing it right through the system. The questions are all in there. The employee is reviewing themselves. It sends back to the doctor, office manager, whoever, to review them. So it gives that full transparency. You're following through. You have that documentation, and you're having those conversations that are really important. And then last but not least, if you're not a client, or if you are just super busy, whatever it might be, just make sure you're subscribing to like our blogs, staying up on our webinars, like coming to these. That's really our job for our clients, and really the industry as a whole, is to let you know what's changing and what to do with those changes. So that staying educated, it's a constant thing. Things are always changing. It's keeping us on our toes, of course, to know what those laws are and make sure you're aware of them. But it's not just the laws, it's also those trends that we want to bring to you and let you know what to do with them. So really important. Again, it's really easy to subscribe to our blog. If you have questions, let us know. But something like that, our newsletters, like we're constantly updating you to help you to be aware of what's happening. And Ian, I'm going to kick it to you for kind of the last piece of this 70/30 rule that you alluded to.
Yeah, thanks, Jill. So, we mentioned this a little bit earlier, but really, if you can boil it down, half of the retention issues in the dental office come down to burnout in some way. And so, there's a whole bunch of people trying to figure out how to solve this problem. We're one piece, I think, of the problem that can be used as a tool to help alleviate some of that burnout, some of that attrition. But a couple things that we really lean on with our customers to help them, retain their internal teams, become more efficient as a practice. One of those things is what we call building your bench. And so we have a solution built into our platform at Toothio where every time you see a dental professional that comes into the office through Toothio, you get the chance to rate them. And it's a two-way rating system. And in the rating process, you can add them to your bench or your custom pool. And so what we're seeing is a tremendous amount of offices are having success by adding Toothio professionals to their bench or on-call list or custom pool, whatever you want to call it, that allows them to tap into that bench in the future on any with very little notice, right? Like at any time they can tap into that bench. They get to see, when they're available. They can send invites out directly. And then one of the benefits of being a tech solution is anytime you post a shift to the Toothio platform, those people that you favorited or that you added to your bench are the first ones to receive invites. And I can't tell you the practices that use the build your bench feature are running so much more efficiently. There's actually some staggering metrics in regards to production and general office efficiency metrics, as well as attrition, internal attrition. So hugely beneficial. And this feeds down into what I talk about, which is kind of the 70/30 rule. And what I mean by that is if you look at the total amount of staff you need to run your dental office, let's say that's 100%. So 100% is, call it 5 hygienists and a handful of assistants. We say staff your practice to 70%. So 70% of the workforce of the internal team you need to service those 100 patients, and then build in the other 30% with Toothio or platforms like Toothio, right? That allows you to tap into that bench, allows you to pull people from the outside in. What that does is it creates a better work-life balance for your internal team. They feel supported, they're not stressed, and your attrition goes through the roof. So we're seeing production increases of anywhere between 30 and 60%, particularly in a handful of emerging up to mid-market DSOs, but it's happening on the individual private practice level as well. And we're also seeing increases in retention on internal staff. Somewhere between 10 and 15% is what we're seeing in the early days, but I think that number is going to grow over the long haul. So again, 70% staffed up internally, and then 30% of that labor being pulled in from whatever whoever you choose as your kind of your staffing provider, if you will. And then I think, being able to flex up for seasonality or emergency needs is so important, particularly seasonality. We see some swings in the dental industry throughout the year from a patient demand standpoint. We have seasonality. And if you're fully staffed to that 100% number all year round, that's great. But when you see those seasonality swings, you start to lose some efficiencies within the office. Whereas if you're able to bring in outside, contingent labor, to help augment your existing staff, you gain those steady streamlined efficiencies all year round. So there's not a lot of waste in the process. You're really maximizing your production, you're maximizing your revenue, and you're supporting your internal teams the way that they want to be supported.
Yeah. And before we jump to questions, if you would like to book a demo, or again, you're a current client of HR for Health, you want to utilize some of our features more, you have questions, whatever it might be, you can scan this QR code and book some time with our team. It'll go to the appropriate teams, depending on if you're a client or not. So feel free to take advantage of this. Like I mentioned, we are going to have a follow up with all of the resources that we shared to make sure that your questions are answered. You have those resources at hand. And so, yeah, I think that, I mean, we're kind of like right up on time. So as we look through the questions, again, we'll reach out with following up on any of those. This is not the last that you will see from Toothio and HR for Health. We're really excited about this partnership, and working to make both of our platforms better and make things easier for you. So we really appreciate having you guys join tonight, and we'll keep you posted on when we do the next one. Again, like all these trends that come up, we want to keep you in the know. So thank you, Ian, for joining us. Thank you, everyone, for joining us, and we will see you all soon.
Okay, thank you, Jill. Have a great night, guys. Take care.
Thanks.